All right, everybody, this is Pill Talk Podcast. This is your host, Dr. Bartu, coming to you with your daily dose of medicine to get you motivated, inspired, and live at your full potential. I have a special guest today, Matthew Hermenau. He's a pharmacist, did a PGY1, went retail for 7 years, and became a PGY2 to help patients in palliative care and pain management. So, Matt, how are you doing today?
Good, Bartu. Thanks for having me on the show today. It's good to
Thank
be
you.
here.
Thank you for being on. Thank you for being on. So we definitely got to get into your journey, talk about what made you want to become a pharmacist, and then a little bit about what made you become a retail pharmacist and then go back into a PGY2. But before we get into all that, let's start from the beginning. What piqued your interest in becoming a pharmacist?
So it's kind of your classic story of being really good in chemistry in high school and having that interest with patients as well. I actually almost went to school for nursing, so I felt like pharmacy was kind of a little different aspect to that, where not as much hands-on work, but a lot of the thought process behind the mechanisms of drugs and how they interact with someone's body. And it just always was really interesting for me, especially, like I said, in chemistry then going on and learning what a pharmacist does. It's kind of like an expert in drugs. So I thought it was very, very interesting from an early age. And like I said, I had support from a lot of my chemistry teachers in high school and my parents that kind of supported me along that path. And it seemed like a very interesting field to go into.
Okay, great. So when going to school for it, did you do the 2-4 program or did you do the 4-4 program?
So I did a 2-4, but technically it was a 0-6 in a way. So it was just strictly all through pharmacy school, but we had 2 years of undergrad, and then the next 4 years were our professional years in pharmacy school. And that was at URI, and I graduated from URI in 2018. But yeah, that is a 0-6 program, University of Rhode Island. Go Rhody Rams. But yeah, that's in Kingston, Rhode Island. And so that's a 0-6 program. A lot of different majors at that college too. So it's not solely pharmacy, which is partially why I chose it too, is just a diverse group of people, a lot of good sports teams, and it's by the beaches too. So you can't really beat that, especially summertime in Rhode Island.
Hey, can't beat that. Good beach, good weather, never. All right, so that's good. You went there, did the 0-6, which is 2 years undergrad, 4 years pharmacy school. You got out of pharmacy school, and then you went into the retail field of pharmacy. So what made you go into retail? And then let's talk about what made you got out of retail.
Absolutely. So I did retail. I worked in retail as an intern during college, all throughout my time at CVS Pharmacy. So I was always doing retail pharmacy, and I worked afterwards too. And I always liked talking with people and getting that interaction. So it was definitely like an area where there's obviously good and bad days, but I mean, like, it's really that interaction and the long-term connections you can have with those patients. So I did that I was an intern for 5 years, still do part-time at CVS right now. And I just maintained myself as a pharmacist right after school. So we all got loans to pay off too. So that was a huge aspect as well, was the amount of loans you're facing postgraduate. And it's really nice to come out of school making an appropriate salary and being able to pay off those loans. So that was initially what I did right after school, is worked and worked many hours a week, as we all do, like when you graduate, just paying off loans, staying with your family, and then I really every day on a day-to-day basis, I even did overnights for a little while in retail. So I've seen all the aspects of it, and it's a grind, but
Yes, sir.
I talked to a lot of patients about pain management, and I saw a lot of opioid use disorder while in retail at the places I was working at. And I really appreciated those conversations I had with doctors, especially over the phone and some of the clinics that were nearby. But I just wanted a little more interaction and a little more responsibility for these patients, because I just didn't feel like I was getting enough in a retail setting.
Okay. So you finish pharmacy school, you did a PGY1. All right, let's go back to that. The PGY1 that you did it focus in on retail pharmacy?
So the PGY one was a general residency at the VA in Providence, Rhode Island. So
Okay.
the VA, if there's, for anyone who's listening, the VA is really, they support the veterans of our nation. So whether they're current military or former military, a lot of the veterans go to these VAs across the country. And in Providence, Rhode Island, we have an awesome program where we were able to treat the patients. There's an inpatient area of our VA, and there's also like the outpatient clinic basis. So we were rotating in both settings. And there's also an inpatient psychiatry ward too. And there's also a lot of, like I said, chronic pain patients in our outpatient clinics. But really, what I loved the most about my PGY1 was treating veterans the best we can possibly treat them, because they go through a lot of stuff, especially once they come back from serving. And we don't really it's hard to appreciate that if you've never been in their shoes. So a lot of veterans face a lot of different problems, whether it's PTSD, depression, and a lot of times like coexisting substance use disorder, which we often see. So really being able to learn and experience that different setting and help our veterans was something that I really took a lot out of during my PGY1.
All right, great. Yeah, for one, getting to a residency isn't the easiest task at all. So I would like to say congratulations for getting into the residency and doing something that is very impactful to our veterans out there. So I appreciate you for that. And then you finished the residency, decided to go into retail, work that. What made you decide? I think you told me, but again, what made you decide to be like, you know what? I can be more impactful in my patient's life if I go back and get a residency, a second year residency, a PGY2. If you don't mind speaking about that, please.
Absolutely. So basically, ever since college, me and my friend and I had this idea of pain management and sports pharmacy. And it's always been this combined idea where we felt that a lot of athletes have a lot of chronic pain management and coexisting depression, psychiatric problems too. So it was a business idea that we thought of initially, was having an expertise skill in pain management that could then be combined into sports pharmacy or sports medicine. And that kind of always stuck with me. And we kind of like kept building upon that. And I then took it to like the next level and was like, I got to do like a PGY in pain management to truly be an expert in this field in pharmacy. So it's led to that point where it's really pain's very cool too, because it's a brand new field that's opening up. And it's almost like a lot of the stuff you're seeing with either cannabis or psychedelics, it's brand new. So it's a lot of undiscovered areas. And a lot of times you're creating your job and where you're going to go and after you finish the residency. And that's not a negative thing at all. It's really a positive thing, because you're creating your job and your role and showing other institutions what you're able to do. So, but what led me really to pain was the sports pharmacy aspect and chronic pain as like throughout my life too, in sports and injuries, and just an appreciation for that patient population, because we grew up like during the opioid epidemic, and it's still now present with fentanyl, but seeing that the most. And now a lot of the documentaries you're seeing nowadays showing what was happening was really a huge movement, especially during college. So a lot of those aspects led me down to being interested in pain management and palliative care too, because that's a major aspect. But yeah, so I applied to a bunch of different programs, and residencies are crazy, but I moved from Rhode Island to Florida just this past summer and ended up in Jacksonville. But yeah, so that's where I'm currently at, but we only have like a week left.
Number two, this piqued your interest because you said like sports and sports management. Were you an athlete in undergrad or high school? And did you have pain that you had to overcome while you was there?
Yeah, so for number one, I've always been by the water, and I've never been like tucked into too much. So I've never been that far into the state. So always been by the water, love the water. And really like what piqued my interest. So in college, I wasn't an athlete, but I didn't actually play D1 sports because I went to a D1 college. But in high school, I played sports. I love basketball, football. I did like multiple sports, and could have tried to like play like D3 basketball, but I just felt that pharmacy was more important, getting an education and just trying to pursue that path. But yeah, I tore my ACL and had surgery on that, and like broke a couple bones in my arms. And and my wrist from like sports. So I mean, just like a recovery process of an athlete is something that you need to really take into account, especially these players that are in like high impact sports. So like football, hockey, even basketballs too, they're pretty high impact if you like hit hard enough. So I mean, understanding like what the athlete's going through and like experiencing that into a degree is definitely important in terms of like how you're going to treat these patients. So that's really important. And just seeing what a lot of athletes going through nowadays, not only chronic pain, but depression and anxiety, especially with COVID, it's really now growing. It's now becoming more mainstream, but this has been a thing for quite a long period of time. And it's finally getting the attention it deserves. And a lot of these big time athletes are speaking up for it. Like you got guys like, let me see, you had Naomi Osaka, which recently had like she was talking about anxiety and depression and like how much the media was like pressuring her to do certain things. And there are a couple NHL players that had like post-concussive CTE that was just severe depression and that was never really treated that well. And it's really being like brought up because a lot of times you don't see this until maybe after the player's career, and it may be short-lived in their career, but then afterwards they have to deal with it for the rest of their lives. So it's always piqued my interest, and pharmacists can have such a huge role in this area, whether it's like either acute management or chronic management after their career ends.
All right, great. So now we know why it piques your interest. So can you tell the listeners, how can a pharmacist impact the lives of the patients that are going through this pain and situations? If you don't mind speaking about that, please.
Absolutely. So it takes a lot of patience, because when you're a provider for this patient population, oftentimes they're not a lot of great days. So you have to understand that when you're interviewing these patients and you're asking for the first question you ask, oh, how's your day going? The common response I get is, oh, you don't even want to go down that like road, or it's just an awful day. And they'll talk about that for 15, 20, 30 minutes even. It could for a long period of time. And it's hard to get caught up in that sometimes, but you need to understand that these patients go through quite a bit of pain every day, and pain and depression are very often coexisting and mixed, and one leads to poor coping strategies for another. So you got to understand and have patience for this patient population, because a lot of it's like about 20% of America has like at least chronic pain that they experience for the rest of their lives. So, and our older population too is just from a lot of debilitating conditions and breakdown of their joints and bones. So really patience and keeping an open-minded attitude when you're treating these patients. So what we're seeing a lot of now is coexisting opioid use disorder and chronic pain. And that's something that it can be very stigmatized. And we need to understand that these patients, addiction is a disease. And once you recognize that, you got to look at it from an objective standpoint as a provider. Like my job when I'm treating patients with opioid use disorder too, because we see a lot of patients that have that with pain, is mortality reduction. So when it comes to different therapies, I'm looking at it objectively as how can we reduce the mortality in this patient population, and allow them to live longer and live with their families, have jobs, live lives that they want to live that aren't like tied to addiction possibly, and the use of other agents, so like illicits that lead down to a lot worse paths than what would be on some of these coexisting agents like medication-assisted therapy, buprenorphine and methadone. So kind of went on a tangent there, but that's just a couple of pieces that I definitely wanted to address.
Okay, great. So you kind of manage these patients by one, consulting with them, seeing what mental state they're in, and then using the proper medications that they can get or provide them with to manage the actual pain that they're feeling.
Yes. So right now, the current residency I'm in, we rotate in a bunch of different settings. So we have pain management and palliative care. And palliative care is a little bit different than pain management. Palliative care, you've ever heard of hospice before, and palliative care is kind of thrown into that same hat. Not exactly the same, but palliative care is a lot of symptom management, and pain is involved in palliative care, but you're going to deal with a lot of different things, whether it's nausea, vomiting, depression, symptom management. So like a lot of patients are on different tube feeds and have problems like eating different things. So you have to think about those kind of different aspects. But to go back to your question, we have inpatient and outpatient treatment for these that come into us, and our inpatient is we have an acute pain consult service that I'm a part of with a nurse practitioner and anesthesiology team. And we also have a couple different rotations. It's surgery trauma. So a lot of patients that come in for traumas, we're treating them acutely for a lot of their injuries, a lot of resuscitation for a lot of patients. And also in the acute setting, I do rotate for oncology and psychiatry too. So that's a different aspect completely. But on the outside, we see a lot more patients for chronic pain management. So I'm involved in a couple different clinics, whether it's just chronic pain with patients. And sometimes we also treat a lot of sickle cell patients that have chronic pain. So sickle cell is really, really prevalent down south in the African-American population. It's a lot that we see, especially in the Jacksonville and even Miami, where I'm going to be going. It's very prevalent in those areas. So a lot of these patients come in with extreme pain crises from sickle cell. So their blood cells, their red blood cells sickle, causing vaso-occlusion in different parts of their bodies. So a lot of times they're coming in with extreme pain, and once again, it's a stigmatized population. So, but we are treating them in our outpatient clinics, trying to reduce the amount of hospitalizations they're having. And we also treat patients in our palliative care clinic too on the outpatient side. So that is an excellent clinic too. So a lot of those chronic pain patients are seen in those clinics. But I would say our residency as a whole, it's very strong because we have a mixture of inpatient and outpatient pain management, and palliative care too is very, very diverse and mixed into the inpatient side of our program. So it's kind of the best of both worlds. So I felt comfortable going into the job market, like not feeling strapped down to tied down to one thing exactly.
All right, great. Sound like you're doing a lot with all you're doing and helping all the patients with pain management, sickle cell crises, palliative care. So how do you develop a work-life balance to keep you, balanced out to make sure that you are able to provide the best care for your patients and the best care for yourself?
Yeah, that's a great question. I would like to say it's improved from when I first started the residency. I came in here and managed time, but definitely my time management skills weren't the greatest. So it came down to managing my time better and taking accountability for what you want to accomplish during the year too. So once you're able to kind of set deadlines and create them for yourselves and be proactive about your goals, and then you can go home and hopefully not have to do as much work when you go home. But in a residency, unfortunately, a lot of the times I'm coming home to do work. So I still spend time with a lot of my family. I try to go back home when I can, and have a couple friends in the area in Jacksonville and in Miami too. So you definitely need to spend time and go see those people and get away from work sometimes, especially with COVID and the impact on mental health. So I like to work out a lot too. I find that exercise is the best medication for me. Just makes me feel better and really puts you in a better mood to start the day. So, I mean, the balance of all those things is really important, but you definitely can get caught up in the whole work-life balance and only working and never really caring for yourself. So I think that's something that I fell into that trap during my PGY1, and even working in retail. There were weeks where I was working 70 hours a week, 75 hours a week, overnights, and definitely not the healthiest. I'll say that.
You said you work 70 hours a week?
Yep. There were some times where I did that. It's crazy. I mean, when you're young and you're out of grad school, you just want to work a lot and you want to pay off student loans. But like you said, taking care of your health is important.
But I'm glad you found that balance. Matt, let's hope you don't go back to working 70 hours a week. Let's dial it back. But seriously, I'm glad you found that balance and finding that balance with being with family, friends, and then finding your own personal time with working out. Because like you said, when you're able to work out and be with the ones that you love and care for, you're able to come back with a clear mind, clear perspective, and you're able to give the best care for your patients, right? So I do have one more question for you, Matt. It's your career goals and dreams. What do you see yourself 5 to 10 years from now? If you don't mind speaking about that, please.
Absolutely. So I would say in the next 5 years, or 5 or 10 years, I think I just want to hopefully get established in the program I'm going to. So I'm going down to Jackson Health System in Miami, and they don't have a pain pharmacist yet. So I'd be the first one down there. So I want to establish a program down there, and we have opportunities in our outpatient clinics too that are just starting off in its early development. So I'd like to bridge from side of the pain management, work with our anesthesia teams, and develop some outpatient clinics too. I would like to hopefully have a rotation for students that are interested in pain management, or for residents too that want to come by and like learn what we're doing. And eventually the goal is to probably have a PGY2 in pain management program at Jackson, because it's not established just yet. That's definitely my short-term goals and long-term kind of combined. But like I said, settle down. It's been crazy. I haven't really stopped for the past like 6 years, 8 years, like after school. So hopefully slow down a little bit too, and just like kind of get back to a normal life and not be working like crazy during residency.
Understand that. Yeah, residency definitely is like a 24/7 learning experience while you're in it, right? So I do want to commend you for doing a PGY1, working as a pharmacist, and then going back and do a PGY2 to make a more of an impact within the patient lives that you come across with pain management and sports management, excuse me. So if anybody want to get in contact with you and want to know more about pain management, palliative care, or just, a PGY residency and get some information on what they should expect, and they want to reach out to you, can you tell them your Instagram or social media, LinkedIn or website handles so that they can reach out to you, Matt?
Absolutely, Bartu. So I'm avidly posting on LinkedIn, so that's a great. It's just my name, Matthew, and then Hermenau, so Hermenau. My Instagram is just the same. It's Hermenau, my last name, .Matthew. And if you want to reach me on email too, my email is changing because I'm finishing my PGY2 here, but I still check my URI email. So it's mhermenau@my.uri.edu. So I'm checking that a lot. So if anyone has any questions or wants to learn more about pain management and palliative care, by all means.
All right, great. So thank you, Matt, for coming on to Pill Talk Podcast, letting everybody know a little bit about who you are, what you do, and how you're impacting the life of people with palliative care or pain management. And I thank you for coming on.
Thank you very much, Bartu. Thanks for having me.